the modern recovery movement started around, it was in the early 2000s, and there was a lot of things that kind of sparked that. As that recovery movement progressed, people started asking the question so where are the sober, safe, and peer-supported living environments that we need to get people connected to? SAMHSA defined the domains, the supportive domains of recovery as home, health, purpose, and community. And most people, recovery home, that's definitely one, but actually recovery residences support all four. So I think over time, people started understanding the importance of recovery residences. I think one of the key things that had people start focusing on recovery residences was healthcare reform. And there were a couple of key leaders, Dr. Wesley Clark out of SAMHSA, as well as the Office of National Drug Control Policy, David Mineta, Deputy Director David Mineta, really encouraged us to develop a national association and start setting standards and being able to identify providers that are using best practices. And by 2011, NAR was forming. And one of the first things that we had to do is figure out, what are we talking about? Because a sober living home in California looked different than one in Florida versus Texas and Georgia. So we wanted to create a common nomenclature so we could have meaningful conversations. And we also wanted to use strength-based language. So I can have somebody say, oh, I provide a sober living home, and I have no idea what they're talking about unless I ask a whole lot more questions, because nobody can agree on what a sober home is. So I can't tell you what a sober home is, but I can definitely tell you what a recovery residence is. I can actually articulate what level of support. I think there's so many words that are used to describe this type of housing, quarter house, halfway house, and my question is, halfway to what? It's halfway to jail? That's not very strength-based language, and so I want to be defined and identify with my strengths in my recovery, not my disease or my incarceration.